I'm Andrea Fasati. I am a primary care doctor. Actually, I'm an integrative physician, and I work in primary care in South Burlington. And I'm here to talk to you about integrative medicine and how it applies to cancer care and to women's health. Okay. The only disclosure I have is that in addition to working at UVM, I work for the Arizona Center for Integrative Medicine, and I do some fellowship reviews for them, and many of my slides are informed by my time in Arizona, but they didn't pay me to put any of those slides in here, so we're good. So what is integrative medicine, and what does it have to do with cancer care? For those of you who may not be familiar, integrative medicine is really the marriage between conventional medicine and complementary medicine. And this is why I chose this particular diagram this year. I like that it shows the foundation for the kind of medicine that I practice is really conventional medicine, traditional Western medicine, and I'm trained in that. But what I also love about integrative medicine is that we offer so much more. So we meet the patient where they are, we get to know them and all about their lifestyle, whether it's sleep, exercise, how they eat, exactly how they eat actually, their family connections, their spiritual practice, their mind-body practices, and so forth. And then we work with that to create a larger program for them, a larger treatment program for them to help them achieve optimal health and wellness. It's actually a very relationship-centered care, and the first question that I ask most patients is, tell me your story, which is a really interesting one. Most patients have never actually been asked that question. I had an 86-year-old woman. She was one of my first patients here, and by the end of the interview, she was crying because she said nobody had ever asked her or wanted to know about her whole life before, and we went through everything. She started at year 1, so that was that in itself was therapeutic, I think. If you can't tell already, it is an open door policy. So what I want to know is everything. I'm very curious. And we already know that patients who have cancer tend to use a lot of complementary therapies. The estimate is anywhere from 40% to 80%. But oftentimes they don't tell their doctor about this. They don't feel comfortable. They think their doctor's going to say, oh, no, you shouldn't use that herb. Or even if they go to their naturopath might say, oh, no, don't use that chemotherapy. It's actually, that's not totally true. I love the naturopaths in this state. They're really wonderful. But what I'm trying to say is that it's not one or the other. It's all of it. All of it is included. Any therapies that are beneficial or potentially beneficial can be included. So when you open the door and you ask the question, obviously disclosure is much improved, and patients can share what they're interested in and what they are trying, and we can do that in a safe and effective manner. So integrative is not alternative, and this is one of the only things that I'm a little picky about. I would say that alternative medicine means that you're using a different therapy in place of conventional treatment. So when I think of this, I think of a story of a friend of our family. The wife got breast cancer back in the 70s, and she opted for a macrobiotic diet with no conventional care. That's alternative. And the danger in that is that you can prolong time to treatment that would be actually very beneficial. So the goal is not to exclude something like a macrobiotic diet, which is a whole foods diet, and may actually be beneficial for a patient if that is her desire. But we also don't want to delay treatment time. Our goals of treatment for integrative medicine are to improve immunity. Immunity is related to all sorts of things, including inflammation and even stress. Symptom management, so pain control. I should have put fatigue up here because cancer patients have 90% of them present with fatigue of some sort. To improve sleep, relieve stress and mood issues, improve tolerance of conventional therapy. That's an important one, and it's actually one that many oncologists are not even aware of. So there are ways in which we can help patients complete therapy in a way that they wouldn't if they were not using integrative practices. I love that. And most important, I would say, is enhancing a patient's feeling of empowerment and well-being. When you receive a diagnosis of having cancer, suddenly the locus of control is outside of yourself. Okay, you're now dependent on the radiation therapist or the chemo nurse or the surgeon or the chemotherapy itself. You're dependent on your T cells, but your locus of control is elsewhere. And there are so many tools that we can help patients to master and to practice that can bring much of that control back to themselves. There's so much that we can do for our own health and healing. The body is a healing machine, and healing is different for each person, but the body has an innate ability to heal, and that is one of the underlying tenets of integrative medicine. So we want to enhance that. When do we use it? We can use it at any point on the patient continuum, whether it is in risk reduction or prevention. So a daughter of a woman who has breast cancer and wants to reduce her risk but isn't BRCA positive, so maybe it's not so clear. What do I do? How do I eat? Is there anything, more than just kind of a waiting game? It can be during treatment. It's effective during chemotherapy, radiation therapy, surgery, and so forth. We can use it in palliation, and we can also use it in survivorship. So what is it exactly? What are the integrative tools that we help patients learn? Well, this is a small list. Lifestyle is at the top of the list because it's something that we talk to everybody about. And then we have things like nutritional supplements for some, mind-body medicine, manual therapy such as massage. Energy therapies are actually part of integrative medicine, but I don't talk about them that often. And then again, I have patients who can really benefit from them, and we will talk about that at the end of our lecture today. And whole system traditions such as Ayurveda or more traditional Chinese medicine and acupuncture. But also, I have included one of the more important pieces of this, which is conventional care at the bottom, as the foundation for integrative medicine. This is just a more detailed slide of some of the tools I've mentioned, so you can pick any category and see, okay, in mind-body therapies, what's she talking about? Well, maybe we're talking about biofeedback or guided imagery or clinical self-hypnosis or meditation, mindfulness meditation, and so forth. Hi, Roz. Mindfulness meditation. So there are many ways in which we can use any one of these given categories or tools. We're going to start with lifestyle recommendations and then get into more detail about each part. So healthy weight. We do know that weight and obesity may account for up to 20% of all cancer cases. And in 2009, it was estimated that 105,000 cancer cases of 10 primary cancers were related to obesity and cancer. 105,000. If you take 17% of that for breast cancer, that was 33,000 cases. My guess is that it would be higher now because our obesity rate has increased in this country. But what does obesity have to do with cancer anyway? Well, when I went to medical school a really long time ago, which maybe you can't tell because I dye my hair, but when I went to med school like 25 years ago, we were taught that a fat cell is a fat cell. Like, it was inert. It was just there kind of padding your organs or your subcutaneous area. What we know now is that a fat cell is a metabolically active part of your body, and actually your fat stores can be considered an endocrine gland, a whole endocrine gland. Okay, they have many, many effects throughout the body and things that you wouldn't necessarily think about. So an obese person is more likely to have problems with appetite. This is actually true because your fat cells secrete leptin that makes you have cravings for sugar, more inflammation, and so forth. You get the idea. There are obviously problems with insulin resistance, glucose metabolism. This one I think is very interesting at the bottom here, angiogenesis. Why is that important? Well, that can relate to cancer tumor growth and also metastasis. Who knew? Just to highlight a couple of the factors and a couple of the implications of increased body fat. Increased cytokines are associated with this. Cytokines drive inflammation, and we know that inflammation drives carcinogenesis. So, and like every other chronic disease that's out there, okay? So Excess estrogen also increases fat storage, and we know that estrogen receptor positive breast cancer and uterine cancer are more prevalent in women with high body fat contents. Impaired immunity, this can be related to the different immunologic factors that are released, and increased insulin resistance. This is actually not an inert state. So when you have increased insulin resistance, what does that mean? You eat something, your blood sugar goes up. Now you have to release not just the insulin that you would normally release for that, but way more because you're trying to drive that insulin into the cells. Okay, so you're releasing a lot of insulin. Well, when you release insulin, you also release insulin-like growth factor. That's a growth factor. That means it can be a growth factor for cancer cells, which grow more quickly than normal cells. So this is part of the danger of having too much body weight. The American Cancer Society and the American Institute of Cancer Research both put out statements, I think it's like every 10 years or 5 years. And what is their stand on this? The ACS says it's important to balance calories in with calories out. It's important to try to maintain a healthy weight throughout life, and if you gain too much weight, to lose it. Okay, that sounds great, right? Good luck with that. I can tell you that the number one thing that I see patients for in my practice is stress, anything stress related. And the number two thing, which is oftentimes combined with the number one thing, is how do I lose this resistant weight that I just can't seem to lose? What I've come to understand both as a human being and as a physician is that weight loss is a very complex dynamic. It doesn't just depend on calories in and out. We're finally starting to realize that, okay? It depends on your metabolism, how much muscle mass you have, how much fat cells you have, where are they located, are they central, are they not central? It depends on your stress level. It depends on how much sleep you get. It's really complicated. So it's not as simple as calories in, calories out, but this is the official statement, and you know, I'll agree with this. Let's try to maintain a healthy body weight, and when we fall off the wagon, let's do what we can to get back on it, but with a better, more holistic understanding of what that means, because that's really the only way to get there. Physical activity obviously is part of maintaining a healthy weight, and it's important on its own as well. We do know that the most physically active women tend to have less cancer, less breast cancer included. And we know that there's a reduced recurrence rate in patients who exercise at a moderate intensity or higher, which is why Kim Dittis started the Steps to Wellness program here, which is just wonderful, okay? Because she knows that the more you exercise, the better sort of lifestyle modifications you make, the less likely you are to have a recurrence. And she wants to get us all sort of up, walking, active, doing what we can. But it's not just breast cancer. So I just put a little note about a Dana-Farber press release where they said they had had 3 studies that showed a similar implication for colorectal cancer in women. So more exercise, less colorectal cancer recurrence. Here we have the AICR physical activity recommendations, and I do love this one. I used to be a cardiologist, and we used to tell people, okay, 30 to 60 minutes of exercise every day, which is like really hard if you're a couch potato. And then what we realized was the most important thing was to get people up and active, so they were no longer sedentary. So that first step, just up off the sofa, maybe walking the dog, was helpful. Right? It didn't necessarily have to be 30 minutes each and every day of like intense, I'm going to go do a 5-minute run, 5-mile run, 5-minute run. And so I like the idea of being physically active at least 30 minutes a day, but really actually building that into your schedule in a meaningful way, not just going to the gym kind of thing. Stay in motion, it's important. So it can be with your family. It can be by yourself. If your body needs yoga, we're just staying in motion. It doesn't have to be, again, I'm going for that 5-mile run. Nothing wrong with a 5-mile run, but if you're like me, I'm not a runner, but I can walk. My dog gave me a Fitbit for Christmas. He's like, here, take me for some walks. And that's all good. And you do want to build some intensity in there, some interval intensity, but it doesn't have to always be, uphill, basically. So all activities do count, and I'm an Olympic vacuum cleaner. So I actually have vacuumed the walls, the ceiling, and at one point, my dog. And I would say that if you vacuum like I do, if you run up and down 3 flights of stairs like I do with baskets of laundry, and you can do that and you're not getting short of breath. I mean, there are days I do not have time to go to the gym, but I guarantee you I'm getting a good workout. So recreational and household activities both count, especially those of moderate or greater intensity, and we heard that before with the cancer studies, and those sustained over a lifetime. So if you're living in New York City and you're walking to the subway each and every day and you're walking a long way, out to dinner, that counts. That's sustained over a lifetime. When we talk about moderate or greater, we used to call this the talk test in cardiology. What does that mean? If I can have a nice, pleasant conversation with you while I'm exercising, I'm not at a moderate activity level. I mean, I should be able to be conversational, but not sing opera, okay? So that's getting me to about 75, maybe 80% of my maximum predicted heart rate. If I'm really working hard, it's going to be a very short answer. It'll be a couple of words to answer your question, and then we'll just keep exercising. And that's a greater intensity. So that's just sort of a thumb sketch of how to check that out when you're out doing it. The role of nutrition, obviously nutrition is extremely important, both what we eat and what we do not eat. And I put this picture up here to remind us that not every plate is equal. You've got, and I only know this because I was a kid in the 70s, you've got Apple Jacks there. But you've also got, let's say you've got 300 calories or 250 calories of Apple Jacks here. You've also got these plates. First of all, they're probably combined the same number of calories, loaded with phytonutrients. Those plates are not equal. And we do fall into this trap both with kids who won't eat and with cancer patients who have difficulty eating, because we say, just eat something. Eat anything. Eat this sugary thing. Have this Gatorade. Have some ice cream. Okay? Love ice cream too, but in its place. And the bottom line is that's loaded with sugar. Sugar creates inflammation. Sugar prompts the rise of insulin-like growth factor. So you've got to be careful about the way you combine your foods. Not every plate is created equal. And it was estimated in 2009 that if every woman across the United States were to adopt the lifestyle modifications, just the ones that we've only just now talked about, plus stress reduction, which Roz would be happy to help us all with, we could potentially see a decrease of 89,000 cases of breast cancer per year. This is why I went into integrative medicine, because I got really tired of taking care of cardiac patients after they had a heart attack. There's something to be said for prevention and lifestyle modification, like if not now, when, right? Let's just start doing it now. Okay, so we're going to go a little deeper into integrative nutrition. I love this statement because not only does it suggest what we eat, but how we eat. And there was a really interesting study that just came out that correlated the number of hours of fasting overnight with recurrence of breast cancer. Okay, so what they found was in a large cohort of women who fasted for more than 13 hours a night, meaning, the kitchen is closed at 8 p.m. and you don't eat again till 9 a.m. kind of thing. Those women who could fast for more than 13 hours actually had a decreased recurrence rate of 22% less. Now, that sounds awesome. I mean, it is awesome. It's a potential free intervention that we can teach people to do, and we can help them have the ability to do that. But what does it actually mean? There was also a correlation with decreased hemoglobin A1Cs in these patients who fasted for longer periods of time. So they weren't, dealing with glucose and insulin overnight as much. And they had better sleep regimens, obviously. They weren't up eating or up late into the night and getting hungry because of that. So it's a little bit cloudy, but what a great intervention. This is something that we can lean towards. If we have patients who are getting super hungry right before bed, why is that? Let's talk to them about what they're eating for dinner, how they're eating, because that's where we can make a difference, and perhaps they can be that patient who fasts for 14 hours overnight and does better. I also love this statement by Mark Hyman. He is the director of functional medicine at Cleveland Clinic, and he was the physician to Bill Clinton. So he's got some credibility as far as I'm concerned. And he says, food is information. It absolutely is. Not only is food the most common medicine we put into our bodies, the most common, but it can tell us whether or not we're going to increase inflammation or decrease it. It can tell us whether we're going to turn on or off a gene. That's how powerful food is. And we go by it all the time. It's like convenient. We grab it. We don't think about it. But there are ways of implementing changes to be consistent with being healthy in our bodies because we're making the right choices with regards to food. So the principles of integrative medicine or integrative nutrition, there are several that I want to touch on. First of all is that we talk about whole plant-based foods. It's not all plants. We do have animal proteins in there too. But when we talk about whole foods, we don't mean juicing. Juicing takes out the pulp and the fiber. We mean, you can make a smoothie out of kale, but please don't juice it because then you're going to get that same sugar spike. You guys are going to be really good at sugar spikes by the time you leave. And also, I would highly recommend organic food when possible. The Environmental Working Group, or EWG, puts out a list each and every year of the Dirty Dozen and the Clean 15. The Dirty Dozen are the fruits and vegetables that really should be eaten as organic because even if you peel them, you're still going to have pesticides, high levels of pesticides in those fruits and vegetables. And just because it changes a little bit every year and I'm not great at memorizing lists, I kind of remember it in terms of those tend to be the thin-skinned fruits and vegetables. So things like peaches, apples, cherries, strawberries, organic, or local in Vermont because those tend to be almost organic. And then the Clean 15 are the ones that you can eat conventionally without really worrying about pesticides. Our crops have changed over my lifetime of 50 years. They've absolutely changed, and we just have to be cognizant about that. Okay, variety also includes lots of colors. So when we tell our kids, eat your rainbow of colors, like they should say, okay, Mom, you too, because it's really important. Those phytonutrients in a blueberry aren't exactly the same ones as that you get in a banana or a watermelon or a lemon or a piece of garlic. So we don't want all of those at the same exact time, but we want the synergy between them to be helpful in our own bodies. So variety is key. And if a food can potentially help and does not have harm, we recommend it, okay? So if it sounds like a handful of blueberries is going to be great for macular degeneration, let's try it. It's not going to hurt you. Finally, and this is an important point that you will hear over and over in my talk, reliance on a single ingredient is not the same thing. It's not a substitution for whole food. What does that mean? I have a thing with blueberries. If you take a blueberry and you take out your favorite flavonoid from that blueberry, there's probably 1,000 there, by the way. If you take out your absolute number one favorite flavonoid and you say, this is the perfect ingredient, this is going to help our health, and then you concentrate it, so it's like 250,000 times stronger than it is in that blueberry, that's not the same, and you put it in a capsule. That capsule is not a blueberry. It doesn't have the other 1,000 phytonutrients working in synergy, and it's probably being ingested in a much higher dose than your body needs or can handle. So with very few exceptions, this is one of the tenets of integrative nutrition. They're not recommended generally. So what do we eat? Now, this is a handout that I love and I give to almost all of my cancer patients, and you can find this handout on the Arizona Center for Integrative Medicine website under patient handouts. We could spend literally a whole day's conference on this handout alone. So much of what I'm going to go over is just a simplification of it, and this all has data behind it. Healthy fats. Patient populations in large meta-analyses where they eat increased levels of cold fatty fish and have high omega-3 intakes have all sorts of health benefits. People in Iceland don't actually get as depressed as we do here, and they live in the dark. It's because of the omega-3s. So we also know that there's a reduced risk of cancer and breast cancer in patients who have high omega-3 intake. Flax seeds also have omega-3s. We're going to talk about that a little later, but they have something else called lignans, which are healthy and beneficial as well in cancer prevention. Olive oil, which is a monounsaturated fatty acid, is also linked to decreased cancer prevalence. It's a big part of the Mediterranean diet and very helpful ingredient in that. Soy, people are always surprised when I mention this one because they say, but it's breast cancer. Well, okay, so 1 to 2 servings daily of whole soy, whole organic or local again, because soy really holds on to pesticides and there's a lot of pesticides used in this country to grow soy. But whole soy is actually quite beneficial. Whole soy is tofu, tempeh, it's all the pictures here. The edamame, the soy nuts, soy milk. What it isn't is it is not soy isolates. It's not the stuff that's boiled down to protein powder and put into a protein bar like a Luna bar. And it's not the same thing as a soy burger. I hope they've gotten rid of those. But soy is not a soy burger. Soy is tofu. And that we encourage patients to eat 1 to 2 servings per day. We have seen in cultural studies that women who are raised in Asian cultures actually have a lower risk of breast cancer, and it is thought to be due to their ingestion of soys, which have weak estrogenic properties during adolescence, especially when breast tissue is developing. And what's really interesting and kind of sad is that if they adopt a Western diet later in life, or if their family immigrates into a Western country, within 1 to 2 generations, they have the same incidence and prevalence of breast cancer as we do. What is that telling you about what you're eating? By the way, it has aromatase inhibitor effects as well, and patients on tamoxifen do better with soy, 1 to 2 servings per day. Cruciferous vegetables are powerhouses and probably one of the #1 veggies that would be recommended by any integrative oncologist. They contain indole 3-carbinol, which is converted to DIM, and they are potent anti-tumor molecules or substances. This is not the same, eating some broccoli, which is a cruciferous vegetable in the Brassica family, it's not the same thing as taking an isolated, capsule with I3C in it. So don't do that. Eat your broccoli. If you don't like broccoli, there's 3,000 varieties of cruciferous. Okay, they're not all edible, but I'm going to show you a list of ones that are. And the only thing that I would say about broccoli, which I learned last year because I was prepping for this talk, is that in cruciferous vegetables, if you eat tons and tons of them raw, they can be goiterogenic. What does that mean? They decrease conversion of into thyroid hormone. So they decrease production of thyroid hormone. And I have seen this with some patients who do kale smoothies all day, every day kind of thing. And they're like, oh, I'm so tired. I look at their TSH and it's a little off. And I'm like, well, just cut back on that kale. And it comes back. So the other thing I would say is this can be denatured by light cooking. And so saute your kale lightly and you're all set. Here's a list of cruciferous vegetables that you can eat. I had no idea, but wasabi and other mustards are actually on the list. There's horseradish, kale. So you get it in lots of different ways. There are some very potent anti-inflammatory roots that we highly recommend. The top are, well, I'm Italian, so I love garlic and onions. So in the alum family, they have excellent correlation with decreased chronic disease and inflammation and cancer, part of the Mediterranean diet again. And then on the bottom, we have ginger, which is on the left, and turmeric on the right. These are actually cousins, and they are both incredibly potent anti-inflammatory roots. And we're going to talk more about turmeric, which is our one exception when we get to supplements. Green tea is probably second to cruciferous when it comes to the effects, the anti-cancer effects. And there are studies that have shown that with drinking 5 or more cups of green tea a day, there is a tendency towards reduced risk of early stage breast cancer. That's a lot of cups of green tea. Well, I would say if you're going to do that, which I love green tea, but make sure that it is organic because you don't want it to have any heavy metals in it. And the best way to do that is organic green tea. So the flavonoid that we think is most bioactive is I always get this wrong because I was a cardiologist. EGCG, not ECG, and epigalactokingalate. And again, wonderful to get this via food, not wonderful to get this in a capsule. There are some times when this supplement, however, may be used by integrative naturopaths or physicians, and in which case, I would just say to use it in conjunction with working with somebody who knows, because it can actually be liver toxic. So you've got to be careful when you use EGCG in a patient who has any sort of chemotherapy that can result in hepatotoxicity. Finally, there's 2 things that are important to limit. One is alcohol. Alcohol use is directly correlated with breast cancer incidence. And it is my recommendation that anyone who has breast cancer or who has had breast cancer reduce their alcohol intake to 1 or fewer drinks per week, not per night, per week. And if somebody is really going to drink and really attached to the glass of wine, I would say 4 ounces per night, no more, and just keep it at that. You're investing in your own future. Finally, sugar. Does sugar feed cancer? Well, kind of. Cancer cells use sugar more efficiently than regular cells, normal cells. And also, sugar, again, drives insulin, insulin-like growth factor, and inflammation. All of those things contribute to carcinogenesis. So I've had patients who come in and I do a really detailed diet history, and they'll say, oh yeah, but I'm drinking like 5 cups of green tea a day. It's so great. And I got rid of my white sugar habit. White sugar is, honey is just as bad as white sugar. I mean, it's natural, yes, but you still don't want to be putting a tablespoon in each one of those cups of green tea. Because if you're doing that, you're getting 5 times the upper recommended limit of sugar per day. There's not a recommended daily allowance. There's no RDA for sugar. We get plenty of sugar just by eating fruits and vegetables, okay? It's all the added sugar, yes. Yeah, diet sodas are also, they're awful. Yes. Exactly. Kind of like high fructose corn syrup, which is 5 times or 50 times sweeter than normal sugar. It promotes insulin secretion, yes, and it causes inflammation. And actually, diet sodas are kind of complicated. They find that patients who drink them gain weight, and part of the problem is that your body is waiting. It tastes the sugar, and it's waiting for the calories. So you're not getting the calories, so it starts eating them. So diet sodas, I just absolutely would... When I have patients, regular soda also, same thing. It's all added sugar. And actually, on the American Heart Association, the AHA website, if you write Sugar 101, it has a fantastic sort of description of the limits that we should have on sugar, all the different names for sugar. There's like 24 different names. So you can be easily fooled. And I give that link to many of my patients as well. Thanks for mentioning that. Okay, so are supplements ever safe or effective or usable for cancer patients? This is like a row in Healthy Living, I'm sure. I see patients there all the time looking at all the supplements. They're not sure what to take, but they know that they need something because they're not feeling that well. So in 2006, there was a statement released that said there really is no evidence at this time that supplements work to decrease the risk of cancer, and in fact, sometimes can be harmful. That sometimes can be harmful part is true. There have been studies on limited number of supplements, such as high doses of beta-carotene in patients who have who are smokers who develop more lung cancer. So absolutely, that can be true, and that's one of the reasons working with a knowledgeable practitioner is so important. However, I would argue that there are some uses of supplements that can be safe and effective. So what are the concerns that the medical establishment has? This is a valid concern, okay? Are there any herb-drug interactions? Most certainly there are. And when we're looking at the number of supplements on the market, there are tens of thousands of them. They're not regulated. You know, you have to know what company you're buying from because they're not regulated. They could put stuff in there that's not supposed to be in there that can interact with whatever you're taking medically, okay? And there's so many potential interactions, both good and bad, that these will never be all studied. There's no way. So that is a valid point. Data is emerging, but most are not and probably will never be studied. The liver has the cytochrome P450 system. It has the CYP3A4 system for breaking down, for metabolizing drugs, and many supplements affect those. So for example, St. John's wort. If you take St. John's wort and you also take oral contraceptives, your oral contraceptive will be 50% effective. You've denatured it basically, okay? So, and if you don't know that, you're at risk for taking those two things together, and that's not helpful. Anticoagulant effects, so especially things like turmeric, which are so strong and potent, have lots of different wonderful effects. They also have, you know, drug interactions that we have to be aware of. One would be anticoagulation. And phytoestrogen effects as well. And then there's the antioxidant debate. I'm just going to distill this one down for you, which is, first of all, when we use chemotherapy or radiation therapy, what we are doing is inducing oxidative stress to kill the tumors, okay? So if we take high doses of antioxidants, are we going to mess with that or not? That's the question. And I would say probably not. It seems like when we use pharmacologic antioxidants, we actually protect the healthy tissue and still kill the cancer cells. But not totally clear. And I would say it also depends on the supplement. So the best approach would be, in my opinion, to consider the goals of therapy first and foremost. If we're working on palliation with a patient, then comfort is the number one goal. And we can use more herbs and supplements liberally, even if we don't have as much data behind them, as long as the patient is doing well on that. If the goal is cure, then we have to be super careful about it. And we do have a built-in sort of policy, which is the day before, during, and after chemotherapy, many of those herbs and supplements are not used on those days, so they do not directly interfere. And finally, I would strongly recommend, if you're going to take anything during chemotherapy or during cancer therapy, radiation therapy and so forth, to work with a practitioner who's knowledgeable in the field. And we have some excellent, we have one excellent naturopath in town, Amy Littlefield, who I would go to, who knows a lot about it. Oh, I only have 10 minutes left? Oh gosh, okay. Potential benefits of supplements. We'll whip through this. Vitamin D. We all need it. It's an essential part of our bodies. It decreases inflammation. We know that low vitamin D levels are correlated with chronic disease and cancer, and so replacing vitamin D to a normal level is extremely important, in my opinion. Omega-3s, same kind of deal, okay? We tend to have a very pro-inflammatory diet in the West. We have a lot more omega-6s and omega-9s in our diet just because of the processed foods that we eat and so forth. And boosting our omega-3 levels can be an important part of decreasing inflammation and helping to heal the body and chronic disease. I personally give slightly higher doses than 1,000 milligrams daily, but Harvard is looking at 1,000 milligrams daily. Melatonin is very important as well. It is the hormone that we call the sleep hormone. Not only is it good for sleep, it is good as an antioxidant, it is an immune booster, and it is hormone modulating. We do know that it declines with age, so over the age of 50, we do not produce as much melatonin. And this is interesting because sleep is correlated, or lack of sleep is correlated with increased risk of cancer. And there was just a couple of studies that came out this year. One looking at shift work, either permanent or rotating, increasing the risk of breast cancer. There was another one in airline stewardesses that, took out the radiation exposure in flight and looked at, took out how many times they had been pregnant and still found that the number of time zones they crossed, so their circadian dysregulation, right, was correlated with an increased risk of breast cancer, 5 or 10 years later. Excessive exposure to artificial light. So if you live in the city and you're like right underneath the lights of Fenway Park, you might be in some trouble, get those room darkening shades. And sleep hygiene is a cornerstone of integrative medicine. It's something that we work very hard on with patients to make sure they have restful, restorative sleep. Melatonin, however, is more than sleep, and we do see that in meta-analysis of 8 randomized controlled trials, there is an improved survival rate and improved everything with the use of high doses of melatonin, even a decrease in radio and chemo side effects, which is significant. We use high doses for that, 20 milligrams, and if you're just coming in and asking me what should I take for sleep, I'd probably tell you 1 to 3 milligrams. So this is something we titrate up over a couple of weeks or even a month to get patients there. They generally tolerate it very well, and there are very few side effects. It has direct inhibitory effects on cancer cells. It's an aromatase inhibitor as well. You can use it with patients who are undergoing treatment with tamoxifen. Medicinal mushrooms are excellent, same kind of effects as melatonin has, so anti-inflammatory. They have anti-tumor effects, antioxidant effects, and immune modulation. There's a large variety of medicinal mushrooms. It's like an art in itself. So I would say there are some special considerations. Quality control becomes super important. If you have cancer, you don't want to be just using the tincture that some dude is making in his basement and selling at the farmer's market. Might be wonderful stuff, okay? But at the same time, I would say that you're at risk for neutropenia, you're at risk for being immune deficient, and there's so many other things that could be going on in your body that I'd be super careful with the brands and the doses and the types of mushrooms that I would choose. So we want to match the appropriate mushroom species and dose to the cancer treatment. And also, there's some question of whether or not things like mushrooms or melatonin that are immune stimulating are safe to use in hematologic cancer. So do you actually want to give an immune stimulant to a patient with lymphoma? Maybe, maybe not. I think the jury is still out. So I personally err on the side of caution with that. Curcumin, which is the active ingredient in turmeric, this is that one absolute exception to the rule. We know that curcumin in high doses has extraordinary effects in the body. It is an absolute powerhouse, and it targets many, many processes in a very positive way. It can reduce the risk of cancer, can get rid of cancers. It's a very strong adjuvant to therapy. There was a study in patients with familial polyposis of the colon, so they had thousands and thousands of tumors, and they used a combination, I believe, of curcumin and quercetin, I think it was, and what they found is before these patients went to surgery, like an absolute significant decrease in the actual tumors, like 30% of them were gone. So this is strong, strong stuff, and it impacts cancer progression, initiation, metastases, and so forth. It is a very bioactive substance. These are some of the ways in which it acts on transcription factors and so forth, protein kinases, enzymes. And I put this up just to say it's awesome, and yet this is kind of, to me, a red flag. Like, be super careful using this when you're on chemotherapies, because we don't want to interact with your chemo. We want you to get the full benefit of your chemo. Milk thistle is a lovely supplement. There's a great story behind it I won't go into, but milk thistle is liver protectant, hepatoprotectant, and sometimes it can be used to help patients who are on chemotherapies that can damage the liver actually get to the end of their chemo treatment instead of having to stop prematurely. I'll just say that. So it's one to consider. Absolutely, milk thistle. Oops. Miracle fruit. My finger is going faster than my brain. Miracle fruit is, it's a new one, I have a friend who's an oncologist in Miami, and he uses this with patients. He's actually developed his own supplement for this, but generally speaking, what it does is it gets rid of the bitter, it coats the bitter tongue receptors so that foods don't taste bitter or metallic. Those metallic bitter tastes that patients can get when they have chemotherapy, and it diminishes their appetite. This is something that we can actually do. It's a fruit. It's not going to hurt them. And they can use it before meals to help them eat good food, not just Gatorade, and so they can actually get those benefits of healthy calories in. Mind-body therapies in cancer care, there are many to choose from. In general, I would say the most important piece of this is that improves stress management markedly, helps with side effects, and helps with quality of life, mostly because it decreases stress. What does stress have to do with cancer? A lot. Catecholamines are released, and cortisol is released, and both of those things can directly and indirectly affect factors that promote cancer. So the relaxation response, remember early on we mentioned that the body is a healing machine. It has the innate ability to heal itself in whatever way possible at any given moment. And by inducing the relaxation response, we actually allow our bodies to do that. Your body's much more likely to be able to heal if it's not flooded with cortisol, if it's not flooded with catecholamines and adrenaline. When I teach patients the relaxation response, I'll just mention that I start here with belly breathing. So I let them know that if they slow their breathing, we practice this in my office, and they breathe in slowly to the count of 5 and out slowly to the count of 5. What they wind up with is a respiratory rate around 6. That actually increases their parasympathetic tone. And so their body says to their brain, hey, I'm relaxed because I'm breathing slowly. And the brain says, oh yeah, I'm relaxed. And you get this really nice positive feedback loop. It goes both ways. These things are bidirectional. Body, mind, mind, body. There are many options. Social support for many patients, not for all patients. Journaling, art therapy, guided imagery, clinical self-hypnosis. The list goes on and on. We have a wonderful mindfulness class here that Roz teaches. Biofeedback, yoga, tai chi. So many options. Something for everyone. And you can do it in bed before you get up for the day. This is just one small example of the use of hypnosis before surgery, just a very short 15-minute intervention compared to talk therapy. So they had contact with a practitioner, both sets of patients, and what they found was patients with clinical self-hypnosis wound up with less anesthesia, and here's the important part from my perspective, less OR time, less time in surgery. We saved money, so if you're the hospital and you want to save money, and saving money means getting the patient in, getting the patient out, and getting to the next patient, so maybe you can have even more patients. It's kind of like waitressing. That's a good thing. So we want to be able to show that our interventions, our integrative interventions, save money at the end of the day and save time. Massage therapy is excellent, and it's recommended for stress reduction and anxiety reduction. It also helps for pain, lymphedema, and fatigue. There is a large uncontrolled study at Memorial Sloan Kettering where they showed that patients just love massage. I mean, who doesn't love a fantastic massage, right? So 50% reduction in symptoms. What drug does that? I'm just wondering. So let's just go for massages today, I'd say. Evidence-based practice guidelines for integrative oncology do recommend massage for anxiety and pain, and they recommend that it is offered by oncology-trained massage therapists. Here we are fortunate to have Janet Kahn, who I adore, and she developed the Touch Caring in Cancer program that she offers several times a year here for patients and their caregivers. Acupuncture has a long history of benefit. It's used widely in cancer centers. The first sort of recognition came for chemotherapy-induced nausea and vomiting. It works fantastically well for that. But it really doesn't stop there. The benefits of acupuncture extend to many other kinds of symptoms that can result from both cancer itself and from cancer treatment. So fatigue, hot flashes, muscle pains, joint aches when you're on an aromatase inhibitor, all sorts of stuff. It can actually even help with diarrhea from radiation-induced enteritis. That's really saying something. It's, as I mentioned, safe and effective. The one caveat is that sometimes medicine worries that, you can have a problem if somebody has got low platelet count or low white blood cell counts. And what we found in studies is it doesn't actually correlate. These are tiny needles. In general, it's extremely safe, as I said, and effective. So when they actually do studies on that, it doesn't correlate. Energy therapies, I told you I'd get back to this one. So it doesn't actually look like this unless you are probably a skilled practitioner, might see this kind of thing in hands. But energy therapy, I absolutely have to include here. Why? Because patients request it. It is a deeply healing process. It elicits the relaxation response. It decreases anxiety. And there's nothing bad about that. And there's no downside. Literally, there's no downside. There's no risk involved in healing touch, Reiki, or Qigong. So just to give you an idea of what it actually looks like, this is a healing touch session. I actually trained through 4 levels of healing touch, and I can tell you firsthand that it's a very gentle procedure. It's lovely. And in a cervical cancer study, they looked at 60 women who were all depressed. They all had new diagnoses, and they compared relaxation therapy to healing touch to standard care. And what did they find? They found the only patients who had preserved natural killer cells that kill cancer, right, were the ones who got healing touch. Why? Relaxation response, okay? They found their depression scores vanished. They were no longer depressed. And that was not found in any of the other subsets of patients. So I hope that I know I took up the whole 50 minutes, but I hope that I have helped you understand that when a patient receives a diagnosis of cancer, there are so many ways that we can pack their toolbox to empower them. There's so many things that we can do to help them. And not any one patient is the same as any other patient. So this is where integrative care shines, to enable patients to say, this is what I'm going to do with my diet. This is what I'm going to do with my activity. This is how I'm going to use the relaxation response to my benefit. Here are some different modalities I might try. And this is what integrative health has to offer cancer patients. I love that here at the Vermont Cancer Center we have a number of these things. I'm a very avid fan of the integrative health movement that's happening here at UVM, and I'm very active in it. And I have to say, I'm so excited for Kim and for Patty and for all the work that they're putting into the Cancer Center. We already have Steps to Wellness. It's extremely important, and I know it is Kim's passion. We've got psychological support services, nutrition services, healing touch and Reiki, mindfulness meditation, which is a wonderful program based on John Kabat-Zinn's work. We are developing a program to bring some acupuncture to a certain subset of patients. There's pharmacist support, which I personally love because we've got a pharmacist here at the Cancer Center that I can email and say, hey, listen, I'm thinking of this supplement for this patient on this chemotherapeutic agent. What do you think? And she looks it all up for me. It's wonderful. And I do offer integrative consults to patients, not in the Cancer Center, but from the Cancer Center. So if that's something that your patients are interested in, I'd be happy to see them for that. And some good provider resources. I think these slides are all available for you online, so you can download this long lecture. And finally, I saw this on an iced tea label that my daughter was drinking. I was not drinking it. And it said, great things are done by a series of small things brought together. And that is perfect because that is integrative medicine. Thank you.